It can't be seen, but you can feel it. That is chronic inflammation. For those of you who have missed out on my previous video, The Silent Killer, please make sure you go back and watch it. Chronic inflammation is responsible for more than 80% of the diseases of today. It is important that you get it under control to help decrease the risk of the long-term damage. It presents in different people differently, and it may range from being mild to severe, meaning few people may experience mild symptoms of chronic inflammation, and that makes it easy for it to be ignored or the symptoms to be overlooked, while others may be affected very severely. And the ones who seek medical help are at times put on medications for lifelong at times. Could you be affected? Decide for yourself. The signs and symptoms of chronic inflammation. Muscle aches. In the previous video, I had mentioned about the inflammatory cytokines. These get elevated in the body during chronic inflammation and can trigger muscle soreness and swelling. Now, muscle is made up of a lot of muscle fibers. Chronic inflammation can damage these muscle fibers and cause weakness. Joint pains. When inflammation affects joints, there is pain and stiffness. Now, I know sometimes pain and stiffness can also happen after an intense workout, but I'm talking about the pain and stiffness of joints which happen when they are not caused because of an intense workout. Feeling tired. We all have our days when we feel tired, either because of not having enough rest or at times just overworking ourselves. But unexplained tiredness is a cause of concern, and it may be because of chronic inflammation. Problems with memory and concentration. Now, while cognition or mental capacity generally decreases with age, but if there is an increase in inflammatory markers, this is associated with decline in memory. So the person gets more forgetful and has more difficulty in concentration. Skin irritation. If someone has ongoing skin problems in the form of skin dryness, redness, blisters, itching, this again could be a sign of chronic inflammation going on in the body somewhere. Digestive problems. Now, long-standing acidity problems, constipation, bloating, stomach aches, sometimes having loose stool, sometimes tight, getting sick again and again, nutritional deficiencies in spite of eating well, not being able to lose weight although you might be doing just the right things. All these are signs of chronic inflammation. Chronic inflammation can affect any part of the body. When it affects the brain, it causes diseases like Alzheimer's. Now, this is a South Korean actress who recently became the heroine of the country as the 77-year-old was abandoned by her spouse and children while fighting alone against Alzheimer's. Stroke. This is a commonly heard problem. Last year, Pakistani actress Sultana Zafar passed away due to stroke. Parkinson's disease. Famous American boxer Muhammad Ali suffered from this. Epilepsy. Elton John struggles with epilepsy. It's said Alexander the Great had epilepsy, and at that time it was called the sacred disease. When chronic inflammation happens in the lungs, it results in diseases like asthma, hypersensitivity, COPD, which is chronic obstructive pulmonary disease, or diseases as tuberculosis. Chronic inflammation, when it affects the heart, it can cause heart diseases including heart attacks. Yes, chronic inflammation is the underlying reason of heart attacks. Chronic inflammation again can affect bones, joints, and cause diseases like rheumatoid arthritis, ankylosing spondylitis. In the stomach, it causes chronic gastritis, meaning long-standing acidity. It could cause peptic ulcer, meaning the stomach wall has now already started getting damaged. It could cause chronic inflammatory diseases like Crohn's disease. You may have heard of this disease. It causes irritable bowel syndrome. Now, these patients are generally very anxious in nature and they have to go to the toilet probably every 30 minutes after meals or immediately after eating. Have you heard of someone constantly complaining of body aches or extreme tiredness? Nothing clear-cut comes out in the reports which could give a clue to the pain. The pain worsens with physical or mental activity but does not get better with rest. At times, the patient could even be confined to a wheelchair because of the pain. This is CFS, chronic fatigue syndrome, and this happens due to chronic inflammation of muscle fibers. By now, you know inflammation going into overdrive leads to autoimmune diseases. Autoimmune diseases such as SLE, systemic lupus erythematosus. Well, in 2015, when Selena Gomez posted about her kidney transplant, now kidney disease is a complication of SLE, people became aware about this disease. And then there are cancers. Research has proved that inflammation is an important player. Other diseases of today, diabetes type 2, cholesterol issues, hypertension, all of them, they have the underlying cause as chronic inflammation. Roosevelt said, "Learn from the mistakes of others. You can't live long enough to make them all yourself." At times, people become aware of a disease only after they or someone very close to them gets affected with this. But you can also become aware seeing examples of others in your surroundings. You have to decide which category do you want to be in. Share this video with everyone you know, increase awareness and play your part in working towards a world where health is simply not restricted to those who can afford it, but to every individual on this earth.